Thank you all so much again for joining us for the second seminar in this four-part series. Again, we hope that the information that we are providing to people in Louisiana and any of you joining us from elsewhere will deepen your understanding of the policy and legal environment that has shaped access to abortion in our state. I am Michelle Ehrenberg. I'm the Executive Director and co-founder of Lift Louisiana. We are a reproductive rights organization that educates, advocates, and litigates to impact policy that will improve the health and well-being of Louisiana's women, their families, and their communities. We have a lot to cover today, but first, a few things that I just want to go over. One, to minimize background noise, we have muted all participants and are not using video. If you have questions, please enter it in the chat and my colleague Robin will ask when we get to Q&A. We have a few polls that we will launch throughout the webinar, so please take a minute to respond to those, including the one at the end. And finally, we are recording this seminar and we will post it on our YouTube channel tomorrow. The seminar from last week is already up there, so if you missed that one, you can check that out as well. So our focus today is on how restrictions on public and private insurance coverage for abortion services imposed by policymakers at the federal and state levels create financial barriers that prevent many people from obtaining the care that they need. We will discuss the federal and state policies at issue, and then we will hear from the New Orleans Abortion Fund about how people in Louisiana are harmed by these restrictions and what they are doing to ensure that people receive access to abortion. It's important to know that the vast majority of people having abortions are poor or low income, are married, and or already have children, and that abortion is not rare. Excuse me. 1 in 4 people will have an abortion before they are 45. Barriers to abortion coverage harm patients. Whether health insurance covers abortion has direct financial implications for patients, particularly those with lower incomes. So we are going to talk through some of the restrictions on abortion at the federal level, or abortion funding at the federal level. Three years after Roe v. Wade was decided, Congress passed the first Hyde Amendment to the fiscal 1977 Medicaid appropriation. Introduced by anti-choice Congressman Henry Hyde, the Hyde Amendment barred the use of federal Medicaid funds for abortion, except when the life of the woman would be endangered by carrying the pregnancy to term. The Hyde Amendment has been reenacted every year since, but exceptions have varied. For more than 40 years, anti-abortion lawmakers have used the specter of federal funding for abortion to justify the Hyde Amendment. As a result, abortion is not covered in most states' Medicaid programs, including in Louisiana. It's important to understand that Medicaid is the nation's main public health insurance program for low-income people. Over 1.4 million people in Louisiana are covered by Medicaid, and women comprise the majority, that's 67% of Louisiana's adult Medicaid beneficiaries. Federal restrictions on public funding for abortion affect women other than those who receive Medicaid as well. Congress and the executive branch have created analogous restrictions for people who obtain their health care coverage through the federal government in many other ways. This includes federal employees and their dependents, military personnel and their dependents, veterans, Peace Corps volunteers, Native Americans and Alaskan Natives, people held in federal prisons or detention centers, and low-income women in the District of Columbia. One long-term goal of anti-abortion legislators has been to eliminate abortion coverage in all private insurance plans, just as they have eliminated coverage under Medicaid. Private coverage of abortion is already highly restricted. Nevertheless, Louisiana has found multiple ways to limit insurance coverage of abortion, including through bans on abortion coverage in health insurance policies offered in the state health insurance exchange that was established by the Affordable Care Act. Louisiana also prohibits public funding for abortion for women eligible for Medicaid or any other state medical assistance for general health care, unless the procedure is necessary to preserve her life or the pregnancy is the result of rape or incest, and those reports have to be made to law enforcement. The statute also provides that if the federal requirement that the state fund abortion under Medicaid in cases of rape and incest no longer applies, then no public funds may be used for abortion in Louisiana except in cases of life endangerment for the pregnant person. Louisiana has also taken many steps to try to, quote, defund Planned Parenthood. So defunding refers to stopping Planned Parenthood from being able to be reimbursed for providing services to people who rely on Medicaid or who are eligible for free or reduced fee services through the Title X program. Since 2016, lawmakers have been trying to prohibit Planned Parenthood from providing services to patients in the Medicaid program. First, attempting to make Planned Parenthood ineligible for Medicaid reimbursement if they provide abortions in Louisiana, which they currently do not. Then passing a law prohibiting the state from having a provider agreement for medical assistance program funding, or Medicaid, with any entity that performs abortions or provides non-abortion services in the same facility that they provide abortions. Essentially, they are presenting Planned Parenthood with a Faustian choice of either providing services to Medicaid patients or providing abortions. Luckily, these provisions are not in effect in Louisiana because currently federal law prohibits this kind of action, and the courts have interpreted the law to ensure that Medicaid recipients have a right to, quote, choose among a range of qualified providers without government interference, meaning states can't decide which providers Medicaid patients receive their care from just because they don't like that provider may perform abortions. So why are all of these restrictions in place? Those opposed to public funding for abortion through Medicaid or other publicly funded programs say that anti-abortion taxpayers should not have to violate their religious or moral convictions by helping to fund insurance plans that cover abortion. They also insist that no compromise policy can satisfy their concerns. The idea that money offered to any abortion provider for any service offsets other expenses or frees up funds for abortion and thus constitutes money for abortion. These funding restrictions give those taxpayers a veto power over insurance coverage that other people can receive. I think most of us can agree that there are many things that our taxpayer dollars are funding that we don't agree with, but abortion is singled out. So at this time, I'd like to turn our seminar over to my friend and colleague, Stephanie Bangle from the New Orleans Abortion Fund. And Stephanie is going to tell us more about the important work the Abortion Fund is doing in the state of Louisiana to ensure that people can access abortion care.
Thank you so much for that introduction, Michelle, and for the invitation to present on today's webinar. I'm so excited to be here today. Excuse me. As Michelle said, my name is Stephanie Bangle. I use she, her pronouns, and I'm the executive director of the New Orleans Abortion Fund. So the New Orleans Abortion Fund, or NOAF, as you'll hear me say quite a bit, We were founded in 2012 to provide financial assistance to people seeking abortion care. And since that time, we have focused on educating the public and our state legislature about the importance of abortion access, funding abortions, and practical support measures, and I'll address a little bit more about that in a moment, across Louisiana and the Gulf South, and defending access through our clinic escort program at the one clinic that remains here in New Orleans. Working with local medical providers, we provide compassionate and empowering assistance to patients seeking abortion care who are unable to fully fund their abortions, and distribute financial pledges as available. And no affirms a person's right to bodily autonomy, self-determination, and moral agency, because we recognize, as I think all of the points that Michelle has already made today really illustrate, that without access, there is no choice. And truly, financial access and the ability to afford the care that you're seeking is one of the biggest decision points in whether or not a person is able to get the care that they want or actually able to terminate a pregnancy in Louisiana. I think that Michelle already did an excellent job illustrating some of the ways that barriers to funding can harm patients, because quite frankly, the question of how barriers to funding harm patients is pretty self-evident. If you can't afford the care that you want, and if the systems and structures through which you receive all of your other healthcare, whether that's Medicaid or private insurance, if those deny funding access to you, you're stuck between a rock and a hard place. But there are a few, I think, key barriers that are really important to address. Financial barriers, money, is obviously the most important one. We know through rigorous research on a national scale that about 47% of Americans, of US adults, don't have access to $400 in an emergency. And I think about that statistic a lot because that is a national statistic. And I think most of us on this call know that Louisiana, when compared to national economic health measurements or economic access measurements, we usually are scraping the bottom. We're bringing up the rear. And given that nearly half of US adults don't have access to $400 in emergency, I can only suspect, I can only imagine that true rate is even higher here in Louisiana. And now adding into the mix everything that folks in our community are experiencing quite viscerally at this moment. You know, Louisiana is experiencing historic job losses. The impact of COVID-19 on the economy, the measures of the economy in Louisiana that are like economic drivers of our state. These are economic impacts that we are going to see for a long time here in Louisiana. And what we are seeing at the New Orleans Abortion Fund and what we're seeing in terms of access to healthcare is that these economic impacts are being felt most profoundly by those who are already economically marginalized, by those who are already systemically oppressed as a result of white supremacist and racist systems that keep folks economically marginalized. And so the people that the New Orleans Abortion Fund works alongside and funds and supports, these are the folks who are experiencing just about everything that's going wrong in our economy and in our political system right now the most severely. So yeah, money is a huge barrier to abortion access, and I don't think that it can be overstated. But something that I do want to address is one of the ways that the New Orleans Abortion Fund has responded to that significant barrier of finances. So since our founding in 2012, we were founded with a focus on funding abortion, making pledges directly to clinics to offset the cost of individual people's abortion care so that they can get in and get the health care that they are choosing for themselves. What we recognized very early on as a result, or in response to COVID-19 and the way that it has impacted every facet of our society, we recognized really early on that that meant that people would have additional needs far beyond just the cost of getting into the abortion clinic, far beyond the cost of the actual appointment. Because while yes, the appointment is costly and is, you know, more than a lot of folks tend to have on hand for an emergency, the reality is that when we only have 3 clinics in a state with 64 parishes, 3 clinics for millions of people who might need abortion care. The reality is that most people who need abortions and who access abortions in Louisiana have to travel some distance. And so in response to COVID-19 and in recognition that many of our clients, even prior to March, have been traveling quite long distances and incurring many, many additional costs outside of the abortion clinic, costs like car rentals, gas to drive 50, 100, 200 miles just to the nearest clinic, the cost of a hotel stay if they are driving a couple hundred miles, because of course we know that there's a 24-hour waiting period between your first appointment and your actual procedural appointment or medication abortion appointment here in the state. The unseen costs related to things like childcare, as Michelle uplifted earlier, the majority of people who receive abortions are already parents, and that bears out with the clientele of the New Orleans Abortion Fund. All of these things combine to make abortion even more expensive and push it even further out of reach for folks. So one of the ways that the New Orleans Abortion Fund has pivoted and responded is starting in March of 2020, we began providing what's called practical support funding. And I guess, Michelle, you can move on to the next slide. I don't have many visuals for y'all. I do want to uplift, really this slide was just self-serving. This is a really beautiful billboard that NOF has been able to launch across the state this week. We have these billboards up in New Orleans, Baton Rouge, and Shreveport, excuse me, the 3 cities in Louisiana that do still have abortion clinics providing care for the people who need it. That was a little digression. I just think it's really beautiful and I'm excited to talk about it. But I was talking about practical support and how abortion funds act as solutions or provide mutual aid oriented community-based solutions to these barriers and challenges around accessing abortion. And so practical support funding is one of the ways that abortion funds like NOF do that. We have started assessing whether or not our clients need that additional bit of financial assistance to make it from their homes to the clinics. Do they need childcare support? Are they missing out on wages? Because, a lot of places in Louisiana don't have paid sick leave. We know that. We don't have tons of job security or support here. Are people traveling long distances and need support with gas? We are doing the work that we can from our model of trusting our clients and believing people when they say that they have needs and working from a community-based perspective to help support filling those needs. And this is one of the ways that we're doing that. And I want to be really clear that abortion funds across the country are rising and responding to barriers and challenges around abortion access funding in this and other ways. We are a network, abortion funds are, and practical support funds are. We are a network, 70 some odd organizations deep across the country that work in collaboration to help people access their care. And while I will never stop crowing about how beautiful and how inspirational these networks are and the model of abortion funds are, the reality is, and something you'll hear me say a lot, is that our organization exists to fill gaps because our government has dropped the ball. Our organization exists, abortion funds exist, practical support funds exist to fill the gaps where the people that we elect to supposedly represent us are failing us as representatives. And while I think it's important to celebrate the beauty and ingenuity and mutual aid orientation of abortion funds and organizations like ours, I think we also have to fight like hell to put ourselves out of business, because people shouldn't have to jump through hoops to get their health care. People shouldn't have to get on the phone with us and weigh out how much they can afford to shave off of their grocery bill this week just to be able to afford their health care. And while NOF and organizations like ours will be here to fill those gaps, I want to see a world where we don't have to fill those gaps. I want to see a world where the barriers to accessing abortion are just like, oh shoot, can I get off work next week? So all of this is to say that there are many, many barriers to accessing abortion, and while finances are at the forefront of them, we still need to be fighting like hell to help people access the care that they want, to help people be able to afford the care that they want, and to shift the environment so that they're not stigmatized in even thinking about choosing abortion or pursuing that care. So thanks for having me. And I hope that y'all have questions because I'd love to talk more.
Thank you, Stephanie. We do have some questions, and I'm going to turn the question and answer now over to my colleague, Robin Barber.
Thank you. Thank you, Stephanie, for your presentation. It was excellent. Our first question is, can you tell us a little bit more? Hold on, y'all. Can you tell us a little bit more about the clients that NO serves? And in particular, who is coming to you for financial assistance?
Yeah, that's a great question. So despite our name, we serve clients from across Louisiana and the Gulf South. So that means people who live in Louisiana or live in the Gulf South region and are seeking care in our state, or who are seeking care outside of our state. For example, if someone is having a hard time getting an appointment on the timeline that they're looking for in Louisiana and they decide to go to Texas, or if someone is seeking an abortion beyond the gestational limit in the state of Louisiana and going to another state with a later gestational limit. We also serve people who are coming from surrounding states into Louisiana to receive care. So for example, people in Arkansas who drive down to Hope Clinic in Shreveport. In terms of sort of the general demographics of who our callers are, the majority of our client base, our callers, are people in Louisiana. The majority of them are cis women. The majority of them identify as Black or African American. I believe offhand that the median age is about 27 or 28 years old, though we, since our founding and pretty much consistently from year to year, serve a client base of people truly across the reproductive lifespan. So from about age 11 to 45. One thing that I didn't mention earlier is that we partner with the Louisiana Judicial Bypass Project, which is administered through Lift Louisiana, to provide additional funding support when needed to minors who are accessing judicial bypass in the state. I also want to uplift that the majority of our callers are already parents. The percentage of that, shifts from, I guess, from data analysis to data analysis, depending on when I'm putting the time bounds. But consistently from year to year, somewhere between 55% and about 3/4 of our callers are already parents. So these are people who know what it means to choose to bring a pregnancy to term. They know what it means to have and raise a child, and they are making an evidence-informed decision that that is not in the cards for them at this time. And you'll hear me say this a lot because I think it's really important. There's often a stigmatizing message that people who get abortion are young or irresponsible or just messing around. And the reality is that people get abortions across their reproductive lifespan and for 1,000,001 reasons.
All right, thank you. Our next question. Stephanie, what is your biggest concern about the anti-abortion policies pushed in Louisiana? And what worries you about Amendment 1?
These are such good questions. I feel like I have a plant in the audience. Oh my gosh. So the first question is like, what is my biggest concern about anti-abortion policies in Louisiana? I think my biggest concern is a sense of complacency that I hear sometimes. And I want to be clear that this is complacency that I hear not only from people in Louisiana, but often from movement allies across the country, I think there's this sense, and I don't think that this is just the case in the realm of reproductive justice or reproductive rights, but I think that there is often a sense that, you know, well, things in Louisiana are just the way that they are. That's Louisiana, you know, these are their values. And I think that the anti-abortion movement in Louisiana, particularly our legislators who are flag wavers for that movement, I think that frankly, they've done a very good job of branding Louisiana as the quote unquote most pro-life state in the nation. When the reality is, and I know that all of y'all know this, that not only are we not the most pro-life state in the nation, but we are a state that goes out of its way to pass policies that are not pro-life or pro-family. We are a state that goes out of our way to keep the minimum wage down at $7.25 an hour, to reject calls for expanded medical leave, raising the minimum wage, for parent-forward policies. You know, our state sucks when it comes to pro-life politics, if we're going to get real about it. But anti-abortion legislators have done a very good job with branding. And so my biggest concern is not necessarily a specific policy that they're going to put forward, but more this idea of complacency that people are just kind of saying like, well, yeah, that's Louisiana, that's what they do. When the reality is, I mean, all of y'all are here. The reality is that we are a state with a movement for reproductive justice. We're a state with a strong bench of advocates, of people who don't believe in this shit, of people who want to see proactive and progressive change for the good, for the community and the state that they love. And I want to hear that message being put forward more. That's my long answer for the first question. The second one was, what is my biggest concern about this amendment? I'm going to give you two, but I'm going to try to keep it short. My first big concern about this amendment, and you know, I didn't actually even see what it is. There's an amendment 1 when we vote in November, or in October if you're early voting. On our ballots, there will be a proposed constitutional amendment that if it's passed will add language to the state constitution saying that there is no right to abortion and no right to funding of abortion to be found in the Louisiana state constitution. And so my biggest concerns around that are twofold. The first one might seem insignificant, but I really don't think it is. The first one is the symbolic victory. Because like I was saying a minute ago, there is sometimes in some sectors of our universe this sense of complacency that like, well, yeah, Louisiana, this is just what they value. We're just not going to win on reproductive rights there. And I think that that is dangerous. And you know, if we don't believe in our capacity to change our community for the better, that's dangerous. That's when we stop moving. And so my first concern around this is a symbolic victory. The idea that it's just another crown or like another cherry on top of the anti-abortion sundae that they've been building for the last couple of decades here in our state, and using us and our bodies and our rights as, let me see if I can continue this metaphor, as the ice cream. The second concern around this amendment for me is if this language is added to the Louisiana Constitution, if our state constitution says that nothing in our constitution shall be found to construe the right to abortion or the right to abortion funding, what happens when in a couple of years our progressive organizing and our get out the vote organizing and our successful census redistricting, have you all finished your censuses yet? Means that we've suddenly got progressive legislators in the state legislature who want to advance abortion rights as opposed to, you know, batting off more legislation that's taking them away. What happens if we're able to pass a proactive progressive policy expanding abortion rights? Antis can sue on the basis of our state constitution. They could say that it's incompatible with our constitution. I'm afraid that this would make our entire body of law in Louisiana incompatible with the expansion of rights. And that is extremely dangerous and scary to me.
Okay. I think you covered this. I'll ask it again, but I think you answered it. regarding the role you think that stigma has on people having conversations in our community about abortion.
Yeah, I mean, to your point, Robin, I don't think that we can talk about stigma enough because the reality is that stigma thrives in silence. And so we need to name it, claim it, and shame it, and push it out. We need to talk about abortion out loud and celebrate. I mean, let's be real, like we need to celebrate the opportunities that abortion provides us, that having access to bodily autonomy provides us. So I guess to the initial question, you know, anti-abortion advocates, politicians, organizers have done a very good job of silencing us around the issue of abortion. They've done a very good job, like I was saying before, of kind of branding abortion as something that should live in the shadows. It's something that should be shameful and stigmatized. And the reality is that when we don't talk about abortion, it does become stigmatized. Mm-hmm. Like Michelle was saying, 1 in 4, and you know, this, I want to point out, this particular data point is specific to cis women, but we know that not only cis women access abortion care, but 1 in 4 cis women will have an abortion by the time she's 45. 1 in 4, that's people in your family, your friend groups, your faith communities, your neighbors.
Your church.
Your church, yeah. I said faith communities, but I should have said church because you're right, Robin. I think that oftentimes that is where it is the most silenced and the most shamed. But the reality is that that stigma and that shame is perpetuated because we're not talking about it, because we're not saying like, yeah, I'm someone who's had an abortion. And I think that, I mean, I can't speak for everyone, but I know that I've had the most powerful experiences when I just say like, yeah, I've had an abortion in a conversation with a bunch of women. It could be a group of people I've never spoken to before. But when you say like, yeah, I've had an abortion without shame, without fear, without stigma, suddenly everyone opens up and talks about their own experiences with it, whether they've had one themselves or their sister had an abortion or they took their cousin to go get one, or, you know, everyone has some sort of experience and relationship to it. But when we're able to, when we don't talk about it, we let that stigma thrive. And I want to name, because I know that I have heard in the past that when I talk about challenging stigma, that I can make it sound fairly easy. Like, yeah, just do it, right? And I know that that's not, that doesn't always feel safe. Because the reality is that our opponents, anti-abortion activists and faith leaders and legislators have done a really good job of painting abortion as something that's bad and something that could potentially get you shamed or pushed out of your family or your community. And I want to acknowledge that. I know that it's not as simple for many people as just like putting on an I heart abortion pin and going to the grocery store. But maybe that stigma challenging or stigma busting in your life starts with just having a conversation with someone close to you, or reading about people's abortion stories and experiences on the internet. Maybe it starts with watching compassionate films about abortion access or abortion care. But it has to start somewhere, and it has to start with all of us.
Very good. Next question. Can you talk a little bit about the intersection between domestic abuse and abortion access? And are those same people, as a caveat to that question, and are those same organizations supporting those efforts here in Louisiana, in New Orleans, Louisiana?
That is a really good question. And I think the first thing I should say is acknowledge that the intersection of interpersonal or domestic violence and abortion is not an area where I'm particularly an expert. So I don't want to spend too much time acting like I am. But I think what I can say is that reproductive coercion is a big way that domestic violence is expressed, whether that is, well, I guess there's a couple of things I can say. And reproductive coercion can look like hiding a partner's birth control pills, for example. It could look like poking holes in condoms. It could look like threatening your partner if they want to terminate a pregnancy. It could look like threatening a partner unless they terminate a pregnancy, or abusing a partner to the point of miscarriage. There are a lot of ways that domestic violence and constructs of power and control intersect with abortion access and reproductive care, healthcare. I don't know that I can speak in much more detail about that, aside from just saying that, like, that this is very much a real area of intersection in our work, and something that needs to be constantly addressed. In terms of the second question about whether local domestic violence organizations are involved in our amendment campaign, the answer to that one is not at this time. But certainly NOF is just one of many organizations across the state working to defeat Amendment 1. I want to point you to the Louisiana for Personal Freedoms campaign, which represents a truly statewide coalition effort to defeat this amendment. This year Billboard is NOF's small effort in this campaign, but Louisiana for Personal Freedoms really represents the full statewide effort.
Okay. Our next question is, how is NOF reaching out to the young people of color regarding restrictions on NOF services in order to gain their support and advocacy, and also to let them know about the urgency of Amendment 1?
That's a good question. So we have a really amazing youth-led digital organizing project that was started this summer by two awesome youth fellows who have been working with us for some time, Cassidy Clark and Denise Stefani. It's called NOF Youth Action. It's on Instagram. I strongly recommend everyone follow it because it's probably my favorite Instagram page now. I can pop it in the chat. Oh, thank you, Michelle. The NOF Youth Action is our most direct outreach project for connecting with young voters and young people across the state, including young people of color. I also want to acknowledge that there are a lot of other organizations, both within the state and nationally, that are working with young voters of color across Louisiana on this and other issues related to reproductive justice. And, some of those organizations being Women with a Vision, In Our Own Voices. I know the Feminist Majority Foundation's campus organizers in Louisiana have a specific HBCU oriented organizing program. And I say all of this because I think it's important to acknowledge that, different organizations and different entities engage with our communities in different ways. And while NOF is constantly striving to bring in and organize with and center and educate and build community with young people of color, I think it's important to uplift the fact that organizations like Women with a Vision have been doing that for 30 years and are directly speaking to the people that
Great. Well, we went ahead and Michelle went ahead and launched the poll since the conversation had to do about abortion. If our attendees want to check that out. Michelle has also posted different organizations that are directly involved in regarding that last question that I asked you, Stephanie, for if people wanted to know who those organizations are, if they wanted to support or lift them up. I think that's the end of my question. I'll just ask my own. How do we support NOF in terms of resources or funding? If people want to help you, people who are on this Zoom call want to help, or spread information to other people to let them know how they can help you. How do we do that?
Great question, Robin.
Thank you.
So we always accept donations on our website, neworleansabortionfund.org. There's a big donate button in the corner. We really encourage everyone to sign up for our newsletter and follow us on social media. Our social media team and the work that all of the NOVE staff have been doing that is being uplifted in our newsletters and other communications is just absolutely extraordinary. Our volunteers, our clinic escorts, and our client services volunteers who staff the helpline every day are, I mean, just unbelievable human beings who are making impactful change in our community every day. And so if you are interested in getting more involved as a volunteer, you can also learn more about that on our website. And in terms of how you can help NOVE spread the word about this constitutional amendment and, you know, make sure that we defeat Amendment 1 at the ballot, tell a friend, tell 5 friends, make a pledge to vote, share this beautiful billboard graphic on your social content, share the Louisiana for Personal Freedoms campaign website, and now they're also on social media, so make sure you're following them. And just make sure that you have a voting plan, because we all know that voting is going to be, excuse me, a clusterfuck this year. Make sure you have a voting plan. Make sure that the people in your family and your community have voting plans. Make sure that you are still registered to vote, because the Secretary of State has been doing occasional registration purges. So make sure you check on your own registration on the Go Vote website, and just spread the word.
Great. If any other people have, on this Zoom call, have any other questions, if you could type them in at this time, I'd appreciate it. And so we can get your questions lifted up. If not, I will say that if you also would like to support any means possible by volunteering your time or resources or money, the work of Lift Louisiana, you can go to our website, www.liftlouisiana.org, and support us however you see fit. At this time, I'm going to turn it back over to Michelle.
Thank you so much, Robin. And Stephanie, thank you so much. I know how busy NOVE is with all of the incredible work that you're doing. And so we're very, very grateful that you took this time to participate in this seminar. Yeah, we just are really excited that we were able to have you with us today.
Thank you, Stephanie.
So much for having me.
As I mentioned earlier, we are going to post the recording of this up on our YouTube page. It should be up by tomorrow morning. And we will also be running a rebroadcast of this tonight at 6 p.m. Central Time. So if you just really enjoyed it and you have some friends or family that you think would enjoy it, let them know that they can join us at 6 p.m. We will need them to register with the same page that you registered so that they can get the information for how to join the meeting. And we are going to have our next seminar next Wednesday. It's going to also be very interesting. We are going to have Ellie Schilling, LIFT's co-founder and board president, and local attorney who has represented abortion clinics in the state for years, talk about fighting for abortion rights in the courts. And we are also going to be joined by Mandisa Moore O'Neill, who is going to talk to us about the impact that anti-abortion policies and the anti-abortion agenda has on criminalizing pregnancy, criminalizing abortion, criminalizing people's bodies, and in particular, Black people's bodies and trans people's bodies. So look out for that. If you haven't already registered for that seminar, I highly encourage you to do so. We're going to launch our last poll, which is just a couple questions about whether or not you enjoyed this seminar. And so please take a few minutes to answer that poll before you jump off. And I wish you all a wonderful rest of your week.
Thank you, everyone, for attending. Thank you, Stephanie, again.